Hello and welcome to NCTV episode 60, which is part 2 of the hip replacement series. The first, in episode 59, was about knowing what the signs are when it might be necessary to have a hip replacement, and today is about how you can prepare for a hip replacement once you've made the commitment to have one. There are a number of things that you can do to help prepare for surgery and plan ahead for your homecoming. The better prepared you are, the less anxious you'll be, and it's been shown that patients who have a good knowledge and understanding of their surgical procedure and what to expect afterwards respond better to treatment and rehabilitation. Patients are often scheduled for pre-surgery tests like X-ray, blood and urine samples, for example to check your general health status and to rule out the possibility of an underlying infection. So at this point, make sure also that your doctor knows about any pre-existing conditions and the use of any long-term medication. Two main areas we'll cover today will be reducing your risk of complications and preparing your home. Firstly, the risks for developing complications from surgery can be reduced by ensuring that you are as healthy as possible before surgery, and this will help to speed up your recovery. How can you do this? Well, here are 6 great ways. 1, try to give up smoking or cut down. 2, cut down on alcohol. 3, eat a well-balanced diet. 4, maintain the correct weight for your height, known as your body mass index or BMI. If you have sufficient time before surgery, losing weight will be a help in reducing the load on your hips and knees, as well as your wrists when using crutches. Being overweight and less mobile also increases your risk of developing a clot after surgery. 5, make sure your teeth and gums or any other open wound or sore on the body is free from infection. 6, walk and exercise within the limits of your pain. The more active and independent that you can remain before surgery, the better your outcome after surgery. Keeping fit with some walking and doing exercises to strengthen your hip muscles and legs, as well as your arms and wrists for walking with crutches, will be a great help to your recovery. On to the second main theme now, about preparing your home. The prospect of returning home from hospital can be daunting, so preparing your home and asking a family member or friend to stay with you for the first day or 2 will allow you to focus simply on your own recovery. There are a number of simple changes around the house that you can make to make life easier on your return, and here are 9 of them. 1, remove any loose rugs, as they can be hazardous when you are walking in the house. Tripping or having a fall can obviously damage your new hip joint. 2, make sure you tape down all electrical cords or cables running across your floors to avoid falls. 3, stock up on food that will last to avoid having to make too many trips to the shops after your discharge. 4, you may need to elevate your legs to reduce the swelling during the initial 4 to 6 weeks, and this is best accomplished in a recliner chair or a chair with armrests and a footstool for appropriate leg support. Remember, you have to keep your feet below your hip height to avoid bending your hip past 90 degrees. 5, prepare a sleeping room on the ground floor to ensure that you only have to climb the stairs once a day to bed, so have a comfortable chair to rest in during the day downstairs. 6, make sure you have a cordless phone or a mobile to hand to make it easier when answering phone calls. 7, an apron with large pockets is really useful to move things around the house, as you may be using both hands on your crutches. 8, plan ahead with meals where possible, stock up with some pre-made meals that can go in your freezer. And 9, keep everyday items, for example your cups and bowls and plates, handy and have them accessible between your waist and shoulder height to avoid bending down or reaching up too high. Especially avoid using a kitchen step to get to the top of the cupboard. Next, we move on to special equipment, which will help to ensure an easy recovery following surgery. Usually your physical or occupational therapist will recommend equipment for you, and they will help you and your family in obtaining this equipment, usually rented, following surgery. Some of this equipment may include 1, an elevated toilet seat to ensure that whilst you're sitting, your knees are lower than your hips, preventing bending your hips past 90 degrees. 2, a shower seat or stool, which makes it safe to wash and not slip. 3, handrails and grab bars. And 4, a grasping device like long tweezers or barbecue tongs for putting on socks and shoes or picking up items off the floor. Your physical therapist can also help you prepare by prescribing strengthening exercises to be done before surgery. Being stronger prior to surgery is a big benefit and helps in your rehabilitation process. Your therapist can also teach you exercises that you can do in hospital and how to use your crutches in advance. This helps when you may be feeling a little overwhelmed. Knowing the do's and don'ts and exercises will give you more confidence. More on that in the next episode, but for now, that's it for this week's bite-sized bit to help your health flourish, and I'll see you next time for part 3 on hip replacements. Bye bye for now.